It's been just about 5 years since the public health emergency was called here in BC for the opioid epidemic. Joining me today is Trey Helton from the Overdose Prevention Society. Trey, what can you say about the situation here and what's happening with people overdosing with the toxicity in the drugs?
I don't think it's going to stop. I think it's going to continue. I don't see it stopping, unfortunately. So,
what can be done to help the situation? I know that harm prevention measures have been asked about from the federal government and provincial government. What would you like to see happen?
well, I mean, we need lots of different options for lots of different people. So, some of the things that I see from a street level that would be helpful are obviously safe supply. For people that aren't ready to stop using drugs, they should have access to safe drugs. They shouldn't be buying toxic street drugs. Another option would be detox on demand is something I'd like to see. Like working here at Ops, sometimes people will come up and say, hey, you know what, I'm feeling done. I'd like to find a way out of this where I'm stuck as an entrenched user. And that window is like so small. When it comes down to like getting someone into like detox or treatment, by the time they get access to that, it's 2 weeks have passed and they've changed their minds. So if there was some sort of like detox on demand that I could just call that number and just get someone fast tracked in a cab right into detox, I think that would help a lot of people.
It's unbelievable to see the high number of deaths we've had this year. You've obviously probably lost a lot of friends this past year. I mean, the toxicity in the drugs, I mean, why is it that fentanyl and carfentanil hit the scene like it did?
Just supply and demand. People are always, like, I can speak from my own experience that as a former opiate user, I was always looking for a stronger high that would last longer, that wouldn't get me put into physical withdrawal as quickly. So like fentanyl is the next logical step after heroin. So back when I was using on the street, if we could get our hands on fentanyl patches, we would cook them down and split them between users. Today, like black market fentanyl is the norm. It's been that way since 2016. I don't see it stopping. There is no more heroin. I mean, like everyone's getting fentanyl. It's really, really sad. And now with like the combination of benzo dope on the street, it's just a 50-50 chance. So you either get fentanyl or you get benzofentanyl. It's really, really, really lame.
And the alarming fact is that naloxone doesn't even work for benzo. Is that right?
Yeah, no, it doesn't. It's caused a lot of havoc. The benzo dope, unfortunately, it's essentially turns us into a daycare when we have, like, if it just hits the street that morning, or someone cooks up a batch in their SRO, or a lab releases some drugs on the street, and then they come out here, they sell it. Next thing you know, we got 5 benzo overdoses at once, and BC Ambulatory Services is already overwhelmed. It just turns us into a daycare. We got sleeping mats, people snoozing. We've reversed the fentanyl overdose with naloxone and oxygen, but they're still essentially in a benzo coma. So yeah, it is. It's strained our services, and it's strained BC Ambulatory Services, and it's strained the hospital. So it's a real pain in the butt.
Trey Helton, thanks for joining us today. Back to you in studio.